Hello, everyone. This is Raj, Doctor of Physical Therapy. I am with Swathi Balantrapu, physical therapist, today. So we are going to talk about dehydration. The topic is dehydration and how the dehydration can lead to UTIs, urinary tract infections, especially in elderly people. Men and women both have a risk of getting infections, UTIs, and UTIs can significantly affect their cognition and function. So I have seen patients that are really disoriented, and that's the first sign. Like if you start seeing somebody really disoriented, not really know, they don't know where they are, they don't know what they're doing. So that's a sign that they may be having a UTI. So that's the time you need to evaluate, send them to the doctor for evaluation. So UTIs are very common in elderly population. So I don't really know the percentage wise men versus women, but it is quite normal. I saw so many people with UTIs, but once they are treated, they recover very fast back to normal. So as a physical therapist, we work with them to get them back to the community mobility. So that's the process. A physical therapist helps the patient in managing UTIs, in returning back to the function. So, Swati, do you have any experiences working with patients with UTI?
Yeah, absolutely. So, as you all know, I'm a home health physical therapist as well. So, I see patients on a regular basis, and I see that a lot of times they're like walking with you and doing pretty much everything as instructed. And then suddenly, like one day you go, they just feel like, oh, I don't want to do much today. I don't feel very well. And then you check their blood pressure, and you see that the blood pressure significantly drops, and usually it's like way below 100 on the top and way below 55 or even under 50 on the bottom, which is the diastolic. And that is when that kind of raises a red flag. Okay, it looks like they might be low on their fluids. And then usually what ends up happening is I ask them to drink some water and see if their blood pressure goes up like after 5 or 10 minutes. And if it happens, they probably are dehydrated. And sometimes you can also see visible signs like their eyes are a little sunken. You actually check on their skin elasticity, where when you pull on their skin on their hands, you can see that when you pull and then you just leave it, the skin does not have that elastic recoil, and you see that it's kind of in a pinch state, and it takes like more than few seconds to return back to the normal skin. So that's when you can actually say that they have probably been dehydrated. And also when the dehydration is there for like more than few days, and a lot of times the body tends to actually work efficiently and keep your function normal, but it will fail when the dehydration is like at the point where it cannot do anything. And then that's when you even end up having a urinary tract infection. And that's when you can see like they start to have more falls, and they're like foggy, like Raj mentioned. They're not very oriented. They're like confused. They just say I'm not feeling well, and they don't want to participate in physical therapy. So all of these come up. Then you definitely want to make sure you're checking for that UTI. If they're in home health, then you can have the home health nurse order like a urine sample, urine test, urine analysis, or if they're like not having a nursing service, then you can probably have the family go to the urgent care, especially if they have symptoms like urgency, pain during urination, frequent urination, things of that sort. And then you also kind of educate them on how to drink lots of water, having those structured schedules for drinking water. And most times people think drinking fluids also means coffee or tea. So we have to make sure they're not drinking too much coffee and too much tea. In fact, it acts opposite, where it causes dehydration. So we have to ensure they're not taking too much of caffeinated drinks. And also letting them know it's important to have like a journal where they maintain, or they know how many times they're drinking water and how much water intake is going. So I think those kind of tips will help. And maybe setting alarms on the phones, or having their caregivers remind them, so giving them tips and strategies, how to help with the nutrition intake and promoting healthy behaviors, like nutrition and water intake.
Yeah, great. I think you brought up very good points. I really like them. Burning sensation with urination is what the primary, that's the key to generally diagnosing. It's a red flag, burning sensation when you're urinating, and disorientation, and also treatment wise. Um, Obviously, drinking water, 2 liters of water a day is kind of 8 large glasses is recommended.
Mm-hmm.
Most people I see, they don't drink that much water, and
Mm-hmm.
I tell them to use something like this is, I don't think this is 1 liter, but about 1 liter bottles, so that they know how much they're drinking a day. Like, if I drink two of these a day, I pretty much met my goal, water intake for
Mm-hmm.
the day. And on top of it, if you're drinking juices, or any yogurt or anything, eating fruit, you're getting more fluids in.
Mm-hmm.
So another treatment tip I received from my patients is, cranberry juice. Drinking cranberry juice is, I heard that so many times from my patients. So, and I looked it up on Google. I think in the past, like, it does help, and there are cranberry capsules you can use to avoid UTIs. I believe it just improves immune system overall, maybe because of the content in the cranberries.
Mm-hmm.
So that's one thing that people should be aware of, to drink a lot of water, include some cranberry juice or cranberry capsules after talking to your doctor. So we are
Mm-hmm.
not medical doctors, so what we are saying is just information, passing the information from my patients or Swathi's patients to you. So don't take this as a prescription. So we are just sending, letting you know what options are out there. Um,
Mm-hmm.
so I think those are really key points. And again, you also talked about the caffeine. So don't think that you're drinking fluids when you
Yeah.
drink coffee or
Yeah.
caffeinated products. That's
Right.
not really helping you. It's dehydrating you. Because your caffeine and tea have diuretics, so which makes you go to bathroom more frequently.
Mm-hmm.
So
Mm-hmm.
you're losing more water.
Yeah.
In fact, if you want to retain water, you may have to increase the salt in your food, which retains water. Um,
Mm-hmm.
on the other hand, if you increase the water, if you increase the salt, you may end up having a kidney issues,
Right.
because
Right.
your kidneys are processing. So you need to find that
Fine balance.
balance.
Yeah. Yeah.
Um,
One.
so
Yeah. Um, One other tip I thought will be helpful in the same context is a lot of us don't like drinking water because water is tasteless, obviously, at least for most people, right?
Right.
We don't like drinking water, and people are like, "Oh, I know you want me to drink water. I don't want to drink." So things that I usually say is like maybe flavor it up with like some kind of a fruit. Like you get those fruit
Yep.
infusion bottles where
Mhm.
you can put like berries in the center and have the water infusing. I have the berries kind of soak up like in the night and drink that water. It tastes much better than just regular water. At the same time, you're not putting sugars in it. So in a way, it's like a healthy, water building strategy, I would say. And then I also think sometimes just putting a little bit of sugar can help if they're like absolutely not wanting to drink. Again, you want to make
Or
sure you're
honey.
not diabetic.
Yeah.
Yeah,
Right. Yeah.
yeah,
Honey
yeah.
is a good flavoring as well, sweetener.
Right, right,
Yeah.
right, right. Yeah. And if you have any kidney problems, or if you have any, kidney failure or any chronic kidney disease, make sure you don't drink, water just like that, but you have to check with your doctor how much water intake is allowed for your specific condition, so you're not damaging your kidneys by drinking too much and lots of water.
Exactly.
Yeah, yeah,
Yeah.
yeah.
I think those are really good tips. Thank you very much, Swati, for joining me today.
Absolutely.
Yeah, and we will come up with more videos in the future. So
Mhm.
keep watching, keep liking, subscribe on YouTube if you're watching it on YouTube. Follow us on Facebook. Thank you very much.
Thank you
Thank
all.
you, Swati. Yeah.
Have a
Bye.
good rest of your day. Bye.